Yeah. So once you are ready, you can start. Do you have any questions to ask me before you commence your speaking session?
Sir, no, sir.
Okay, carry on. Go ahead.
Good morning.
Good morning, nurse.
I am Ashwini, one of the registered nurse working in this clinic. Can I know the reason what you here today?
The doctor asked me to meet you, nurse. I don't know what's wrong with him. He asked me to learn about insulin injections. He wants me to change my medication program.
Okay, for the purpose of documentation, can I confirm your name?
Yeah, my name is Ben Johnson. You can call me Mr. Johnson, and I'm 60 years old.
Okay, Ben Johnson. I understand that doctor has advised you to visit the clinic. So this is regarding self-administration of insulin injection as your diabetes is not controlled. Is that right?
Yes, nurse.
Okay, Mr. Johnson. So this will be okay that you administer insulin injection, and this will control your glucose level. I hope this is okay for you.
Yes, of course, nurse.
Okay, then how do you feel about injecting yourself, Mr. Johnson?
I am not very much comfortable, but the thing is, I have to go ahead, right? The doctor has told me so. Maybe what is, I have been managing my diet well with a diabetes diet, medication regimen, and exercise program, but still, what is wrong? I don't know. So he
Uh,
told me to do this.
yes, Johnson, I really appreciate you that you have managed your glucose level with your diet, but that is not working out now, and you have to adopt with insulin injection, and this will help you to control your glucose level. Is that okay for you?
Yeah, nurse.
And I see that you're so panic, and is that I know the reason behind that?
Yeah, I never had taken injections, and that too on my own. I'm a little bit scared normally, and now the doctor tells me to take on my own. How am I going to manage? I don't know. Yeah,
Yeah, Jason. So you don't worry about that, and I will help you to and demonstrate you how to inject yourself. And this is really not. It will not be so painful for you. And this is a very minute injection that you're going to take, and this will not give you much of pain. Is that okay, Mr. Johnson?
yeah, nurse.
And and you have to take on with insulin injection, and this will help you to absorb your absorption will take place in your bloodstream, and you no need to worry of taking tablets anymore, and this will help you to get well better, I think, and it'll be more effective for you also.
Okay, I'll follow that one. And nurse, tell me about the procedure, what I should do, how I should manage all these things.
Yes, Mr. Johnson, you have to wash your hand before doing it, and pinch your skin and insert the needle to 45 to 90-degree angle, and you have to live in place, and you have to not rub for few seconds. For 10 to 15 seconds, you should not rub the area. You just have to live it like that.
Okay,
And this site, no injection site, you have to rotate. If not, there will be lump formation, and it'll be risky for you, and the insulin absorption also will go less. So it is better that you rotate in the site, and that'll be okay for you. Did
yeah,
you
that's
understand,
really
Mr.
fine,
Johnson?
nurse. That's really fine. Thank you very much. And is tell me about um, whether I should take the same injections, okay, every day, and how I have to
No.
proceed with these things.
No, Mr. Johnson. You can just use it for 3 to 4 times, and after that, you have to dispose it safely. And that is very important. You change the syringe very often. And I have a brochure for you, and these are the sites where you have to inject yourself. Hope this will help you out, so, for rotating the injection site around your body. Okay, is that
Okay.
okay for you, Mr. Johnson? Do you have any
Yes,
other concern?
of course, nurse. That's fine. I can understand. And should I use the same needles every day?
No, Mr. Johnson, you have to dispose the needle once, use it for 2 days, and after that, you have to take other needle and use. And proper disposal is very important. You have to handle it care with care. And
Oh,
the insulin also to be stored in the refrigerator if it is unopened. And the insulin should not be exposed to the sunlight or high temperature. And before injecting yourself, please check for the expiry date. And that's good. Is that okay for you, Mr. Johnson?
yes, of course, nurse.
Do you have any other concern?
No. And yeah, now I will take an injection for myself, and you can
Yes,
tell me how it is going to be. So, if any problem is there, I will hint you. You can suggest me there.
sure, Mr. Johnson. We will just go through the procedure.
Yeah. Thank you very much, nurse.
Thank you, Mr. Johnson.
Thank you once again. Okay. So
Yes,
that's good. You're doing well, no doubt regarding that. And
yes.
okay, fine. If you